and thank you again for joining us today with the Stem Cell Healing Institute podcast. We are here again for part 2 with Dr. Rodrigo Santiago, who is our in-house anesthesiologist, who does a beautiful job in working, personalizing treatments, making our patients feel so comfortable with as little to no anxiety as possible, working and aligning with our philosophies at Stem Cell Healing Institute, which our patients know so well, with very little to no pharmaceutical and chemicals, and having the purest possible treatment, less invasive as possible, with the best possible outcomes. And Dr. Santiago helps us do that beautifully. Hello, Dr. Santiago.
Hello, Dr. Figueroa. How are you?
I'm very well, thank you. Thanks for being with us again today.
Thank you very much for being invited.
So today we will discuss more in detail what we do and what in terms of what treatments we offer to our patients in terms of stem cell and regenerative medicine. So the specific treatments we offer and how we deploy, how we sedate in individual cases, and so on and so forth.
I think I don't know how it works because you didn't tell me, but I see that we are in the OR and we took the bone marrow so that you can work with the stem cells. But how is the procedure for preparation for this kind of extraction? Because I think it's being a protocol that you have before the treatment and before the stem cells are getting obtained.
That's right. Yes. Thank you for asking, because it's really important that patients understand that we have a pre-treatment protocol that starts a month or two before they even come for treatment. Okay, because we're so comprehensive in getting to the root cause of disease and pain and different ailments, we have to address everything in a very comprehensive way, because all of the systems of the body, they're not individualized. They all work together and they're all interconnected to create one being. And so that means addressing nutrition, addressing key supplementation in different conditions and different diseases and different ailments. We address lifestyle. We address stress and sleep and gut health and so many different factors that, again, are interconnected for the overall well-being of a patient. And I always say, if you've heard my other podcasts, I always say our well-being is not just our physical body. It's what's here, what's spiritually. So healing is so comprehensive, and we address every aspect, emotional, psychological, as well as the physical. And so that process starts a month or two before our patients come, and once they get to the Stem Cell Healing Institute for treatment, we have another process that begins for pre-treatment again, and that in order to prepare the stem cells and to prepare the body and to create this environment in the body for the utmost healing. And so 3 to 4 days prior to harvesting the stem cells, and then we'll talk about what types of stem cells we use, because we use more than one in the cocktail, more than one type, and depending on the patient and the conditions. But 3 to 4 days prior to harvesting the stem cells, we have a preparatory period to increase viability and the numbers and of the stem cells when we do a bone marrow aspiration, which is where you play a role in every single patient. Unless for whatever reason we don't want to use a bone marrow aspirate, but we have that pre-treatment along with our total detox program, which includes an IV of nutritional IV with glutathione and key key nutrients as well as suppositories and B vitamin shots and a stem cell enhancement formula, oxygen therapy, sometimes growth hormone therapy, so depending on the patient's needs. So yes, a very loaded question and a very loaded answer.
Yes, I usually see only the bone marrow getting away and the beans harvest and they go away and my work is to make them comfortable for the bone marrow extraction and sedate them. But afterwards, you take it to the lab, and the lab is going to be
At the university.
At the university, and it's a very, very big university and a very, very well-known university. I know that they work with I think with the American Embassy.
Yes.
So this is a very big university.
And MIT as
and
well.
they have a lot of characteristics or something that you need to have so that the harvest is going to well, because you need to have it nice for the patient.
Exactly. So we have an ISO 100 facility, and we have specific equipment there. That is the property of the Stem Cell Healing Institute, but we use the facility that is outfitted with everything that we require to fulfill all of the, not only the governmental requirements, but our quality control. And I am there for almost every procedure that takes place in order to ensure that, again, the quality control is there. And you know, it's interesting going back to the sedation and how the light sedation is so non-invasive and you're clear-headed within a matter of minutes. I wanted to mention in the last podcast that I, as a patient, my own patient, I was in the lab processing my own stem cells within an hour of being sedated and having the bone marrow aspiration. So that's a testament to what a wonderful job you do.
I wasn't allowing that kind of procedure. You were supposed to stay at the hospital. But since you went down to see your own harvest, it's nice knowing that patients are going that way. And those are the 5-6 hours that you took in between the sedation in the morning and the sedation in the afternoon, because it takes a lot of time to do it, the work of the stem cells. It's not a matter of 15 minutes like many people preach in the streets. It's you can come here and we are going to make it in an hour and you're going away. It should be done in a very nice and very well-established establishment.
That's right. That's right. And I think the key is also in everything that we do pre and post treatment, but also our cocktails and how specific they're proprietary cocktails that combine different types of stem cells that we have been cultivating and growing and differentiating and proliferating in the lab for days, if not months prior. And so a combination of endometrial and umbilical and bone marrow and sometimes fat stem cells, depending on what the patient's needs are, we will combine it and personalize it along with other proprietary ingredients. And so that plays a really, really important role in how in personalizing and how we treat the patient in obtaining the best possible results in that particular patient, right? And so that's really important to point out, Dr. Santiago.
And the difference between stem cells, PCP, it's the other one that it's
PRP?
PRP, that is very well known and everybody knows in sports that you put it in all the players in the organized sports. What's the difference between one and the other?
The PRP and platelet lysate, that's a really good question.
And stem cells.
And stem cells. And most people do not realize that there is something more advanced than PRP. I was doing PRP 30 years ago while I was still in school. For me, it's obsolete because it's a very sort of crude way of using platelets and growth factors from the patient's blood. I do something a little more, much more refined, much more concentrated, less inflammatory, less number of treatments, and that's called platelet lysate. And I can either do that in and of itself, depending on the level of damage for a patient, or I combine that with a stem cell treatment. Now, the difference between the growth factors versus stem cells is that stem cells they're the gold standard. They're there to regenerate, and they're the ones doing the work. Okay? The growth factors are sort of signaling molecules that signal to the stem cells, like cytokines do in the body, that, hey guys, this is where the damage is, this is where we need to reconstruct. And so that's the difference. So it's the growth factors are one level down from the stem cells, and you need more numbers of treatments, more sessions, and than compared to
And results
stem
are
cells.
faster with stem cells.
Absolutely.
Faster and better.
Very long lasting.
And less treatments, less time lost by the patient.
That's right.
Okay.
That's right.
That's nice knowing.
Yes.
So after you do all that in the morning and we go back in the afternoon to work with the patient, we did a lot of things. We work what we need to work, but usually we work pain.
That's
pain,
right.
It's what I've seen in our experience, a lot of work. And the main factor that I think it's important that people know, it's that since we are not giving analgesics for the treatment.
Anti-inflammatories. That's a super point.
Because you always make me clear that anti-inflammatories are not allowed, and that they only use a little bit of fentanyl in the morning, and in the afternoon a little bit more of fentanyl, so that the patient goes to sleep with midazolam and propofol. And afterwards, I am not allowed to receipt nothing for pain. And usually pain, it's main of the factors that the people are aware of. But the treatment is so effective that people went out of the treatment without pain. I think that only once have we used paraconica in one patient in the last 2 years.
Yes, and I remember that patient, in fact, and that was when we had to actually combine a little bit of arthroscopy for his knee procedure.
I remember the case.
Yes.
We make an arthroscopy for the patient because this patient had a lot of
severe damage.
And a lot of cells in the knee, so it should be cleaned.
That's right, and he chose not to have surgery or prosthetic.
Yeah.
And his goal was to do it with stem cells.
Yes, but stem cells in the one the arthroscopy was done was the one with pain. The other one didn't have pain.
That's right, and I'm really glad that you brought up the point about the anti-inflammatories and how, again, your philosophy and you being empathetic to my needs, in that I cannot use any kind of anti-inflammatories. I don't want to use any kind of anti-inflammatories or NSAIDs or Advil, ibuprofen in my treatments, because it can affect the efficacy of the stem cells and the results. And so I appreciate so much the fact that you are so empathetic to my needs. And instead of the anti-inflammatories, when we have any kind of inflammation, which is what we want somewhat of an inflammatory cascade in the healing process with stem cells and growth factors and the whole cocktail. What we use instead, because of course we don't want the patient suffering, is as needed, the patient can use acetaminophen or the name brand Tylenol, or as most patients know it, in order to alleviate pain without having any secondary effects on the outcomes of the treatment.
And that's the reason, because I suggested you once that we should work with local anesthesia, any kind of puncture or thing that we did, because by putting local anesthesia, we develop
into the skin.
We develop an area that's going to be not making pain after the procedure, and the procedure usually involves a lot of needles. So sometimes people get pain after the procedure because of the needle, not because of the treatment.
That's right.
And we discovered that with the local anesthesia, the amount of pain that we developed is none.
Yes.
None at all. The local anesthesia, it's a goal that makes us work standard better. And afterwards of the procedure, I always got aware of maybe he's going to be with pain. Maybe. And I asked for the residents 2 or 3 hours after the procedure, hey, how's the patient? Nice? No pain? Not pain at all?
Yeah.
It's going home? Okay, nice. Nice knowing. But that's something I try to live with, because one of the things in anesthesia is that usually we as anesthesiologists take care of pain in the after procedure of any patient.
Right.
That's one of our responsibilities. Many times we are not able to take care of that because the surgeon or the oncologist or everyone who is in charge of the patient wants to make it happen them. But usually we make the awareness for the people of the pain that we are going to manage in this way and in this other way, and we usually order medication for the pain in case if it's necessary. But here I have seen that the treatment itself alleviates pain in the patients.
Yes.
In a matter of minutes. It makes around from a 7, 8 number of pain, number in as a scale of pain. It goes to 2 or 1, and the patient tolerates it very well. Because chronic pain, it's one of the most tiredness for the people.
Yes.
Chronic pain tires people.
Absolutely. It's stress on the body.
It stress them. And when they developed a level of alleviation, of getting less pain, for them it's already a goal.
Absolutely.
It's a success in the therapy.
Yep. And we started off by talking about pain because the number one reason for patients to see their doctors is for pain, complaining of pain. And it can take the form of various different conditions. It can be it's purely orthopedic reasons or injuries, sports injuries, or arthritis. It can be an osteoarthritis where it's just wear and tear. It can be rheumatoid arthritis, which involves a little bit more of a complex autoimmune condition. So pain can take on very different faces. And so it's important to note that when we are dealing with joints, for instance, and that can be any joint. In rheumatoid arthritis, we treat a lot of hands and finger joints, and then we have knee joints in sports injuries or shoulders and rotator cuff injuries. It's important to point out that applying and deploying the stem cells locally is really important in joint pain, because the blood supply is very limited to joints, and so we have to place the stem cells. Same with tendons and ligaments. The blood supply is very limited, so the stem cells have to be placed very locally, and we do this without local anesthetic inside the joint space because it can affect the efficacy, and we very often combine these with stem cells to where the blood flows, and that's to the rest of the body. So it's important to point out that, again, we're so comprehensive in our approach that when we deal with joints, it has to be local injection of the stem cells and then also systemically, which we address, again, everywhere the blood flows.
Okay. Now, and I have another thing that I have usually in my mind. We have treated patients for renal problems, pancreas problems. I know someone that we treated that his amount of insulin went down a lot. It was a very young person with diabetes type 1.
Yes.
And the amount of insulin that she needed after the treatment was very, very, very low.
Yes.
In proportion, it was around 20% less.
A little bit more. It was. We've had several patients.
No, the last one was with a doses of 40 in the morning and 25 in the afternoon, and she went from 40 to 25 to 20 in the morning. That was the success I was seeing, and that was also an injection of stem cells in pancreas.
That's
that
right.
was of the treatments we make. And the other one that I remember very, very in my heart, it's the kid with a brain problem that we put stem cells
Yep.
in intrathecal. This kid has a stroke.
Stroke,
He's
21 years old.
21
Yes.
years old. And with the treatment, he recovered a lot of his functions, and at least he developed a 40% more capacity to live.
That's right. You know, his speech improved. He was literally able to take steps for the first time. He was moving the left side of his body, his foot and arm that he was unable to move prior to treatment. That was only after one treatment. Within a year, within about 6 months. And that was after applying the stem cells intrathecally as well, with our proprietary techniques of applying the stem cells, because it's so important when the mesenchymal stem cells combine with the cerebrospinal fluid of in the spinal canal, where there are growth factors that help the proliferation and the differentiation of the stem cells. And then the way that we apply it, and with your special techniques, it's the most effective, allowing the viability and to be intact, and with low concentrations of cocktails, and with the highest possible outcomes, along with everything else that we do. So, you touched on several types of treatments, which I want to reiterate for our viewers. We have peri-organ and intra-organ injections. The kidneys, which of course you've been involved with every single one of them, because we have light sedation with those. And so we have the kidneys, we have liver. We've done cirrhosis of the liver, non-alcoholic and alcoholic cirrhosis of the liver. We've done pancreas injections. We have done penile injections together. We've done all kinds of very intricate injections together, as well as TMJ and ear injections, and
eyes also.
And eyes, ophthalmology, yes, for macular degeneration, retinitis
and gets
pigmentosa.
better the sight of the people.
Absolutely.
And the other thing I've learned that many people with one treatment get a lot better.
Yes.
60 to 70%.
Of just one treatment.
People that could also take 2 or 3 treatments to take a better quality of life.
Absolutely.
And that's the goal, that people get a better life. And more treatments usually are not successfully guarantees. But with one treatment, it's 70% of the success.
At least 70%.
And the patient is happy with that. He can live with that.
Yes.
And that's the goal.
Yeah.
Not trying to make them go through 4 or 5 treatments to see the results of the treatment.
That's
one
right.
treatment, usually it's enough to see the results.
Yep.
And if they don't want to do the go around again, they are going to have a quality life.
Yes, and that I'm so glad you mentioned that, because and that's my goal as a healer, is to do the best possible job and not have to see the patient again, right? And because they're feeling so well, and that's what gets me out of bed every morning, and that's a super good point, because there are other treatments out there where, in order to see the results they require, it requires more than one, maybe 2-3 sessions, and with us, our goal is one time, and hopefully we never see you again. And it depends on the individual needs of the patient and the disease condition and the ailment that we're treating, because not every individual will get this result after one treatment, like a spinal cord injury. Spinal cord injury sometimes requires maybe 2 or 3 treatments. With the one kid, and with other stroke patients in the past, one treatment we saw a lot. and we see a lot. Sometimes it's just not enough, and that's when we will suggest a second treatment. But yes, it depends on the condition and the individual needs of a patient.
We usually don't see the patients again, but we are aware that they are existing because they send us more patients. And that's one of the reasons because we work. Because the people that are happy send us more patients.
That's right.
And this kind of work of podcasting is to develop the need of the people to know what we are doing.
That's right.
Because people that are referred to us, most of them are coming from another patient.
From a word of mouth.
That's mouth to mouth. And that's the biggest success in word. Mouth to mouth is the best publicity agency that exists.
Absolutely. And I'm really glad that you mentioned that, because that's what I tell prospective patients when I speak to them on the phone or do a consult with them when halfway across the world is we do podcasts and some videos, and again, it's so sporadic, but you're right. I would say 90 to 95% of our patients come from other happy patients. And you're right, that is the best publicity, and we're blessed to have that.
And since we are already in Australia, and we're in Canada, and we're in the States, we almost have word around.
And we have
patients.
Africa, yes.
Africa also, yes.
Canada, U.S., Australia, other parts of Latin America, Europe. We have patients coming from Europe all the time. Asia, some from Asia. And so, yeah.
Lebanon.
That's right.
We are getting worldwide.
That's right.
That's success.
That's success.
Okay.
Thank you so much,
Nice
Dr. Santiago,
for inviting me today.
Yes, no, it's been a pleasure. I always love talking to you. I always learn so much from you, and I appreciate you being here with us and with our Stem Cell Healing Institute podcast. And to our listeners and viewers, please follow us and send us any comments or any information you require. We'll have all of the information available to you. Again, thanks again, my friend, and have a beautiful day.
Thank you very much.